My name is Ekile, and I am a student of Mental Health, Substance Use and Addiction program in Conestoga College. I am here with my colleague Nyla and Chris. Can you say hi to the viewers and our audience, please?
Hi.
Hi.
Hi. Hi. Good to have you all, and with your smiling faces, and you all have a lot of positive energy you bring to the podcast today. So this is a podcast as part of the requirements for our course for the course titled Intersectoral Cross-Ministerial Collaborations. And we are expected to have a professional identity reflection and have a resilience plan for ourselves. So it's more like a reflective journey. The assignment reflects our transformation from what we were at the beginning of the course to how we see ourselves now. And for me and for most of us in this group, we have some kind of health background. And then for me, I felt like mental health was seen in just with the medical and clinical lens. But by virtue of having this program, I've been able to understand that seeing it in one dimension really doesn't solve the complexity associated with it. So understanding that there is some psychosocial aspect of supporting individuals with mental health, substance and addiction challenges. Um, so in this first episode, we'll be talking about our professional identity, what value we bring to the table, what our strengths, what our weakness, and what population we intend to work with, having understood what the program is all about. First and foremost, let's start with Nyla. Nyla, for you, what's your core values? What's your strengths? What's your areas of growth? And in the future, what kind of population would you want to work with?
Okay, so for me, my professional identity is grounded in the value of kindness, honesty, and fairness, which has really helped me interact with clients and colleagues. I value kindness and I use it intentionally to create safety and also create therapeutic relationships. I also value honesty, which has really supported me when it comes to communication and trust building with clients. I also value fairness. Fairness aligned with trauma informed principles, and it has also ensured how it has also helped me to treat all clients with respect and without discrimination. My strengths include deep empathy, cultural humility, resilience, calmness during crisis, all of which supports effective mental health practice. My lived experience as an internationally trained nurse um, has strengthened my sensitivity to cultural identity, trauma, migration stress, and systemic barrier. Yeah. I also recognize that I need to continue growing in boundary setting. You get it, especially when I feel emotionally connected to clients. Um, I acknowledge that I'm still developing confidence in advocacy, particularly in multidisciplinary settings where my voice may feel overshadowed. Um, Yes, I identify clinical documentation, especially mental health specific language, as an area for continual improvement. Okay, so moving to your next question, which is the population and environment I feel aligned with. Okay, so I feel aligned working with adults with mental health challenges, individuals facing trauma, people experiencing addiction, and marginalized groups such as immigrants like me or newcomers. I am most comfortable in community mental health, rehabilitation programs, long-term care, mental units, crisis stabilization environments, and supportive house settings. I find environments such as forensic psychiatry, acute psychiatry units with high aggression, and under-resourced setting with high caseload more challenging. So I don't want to go into that. I also acknowledge that challenging settings require stronger boundaries, team support, and supervision for me to thrive. Yeah,
Yeah,
that's what I have to say.
wonderful, wonderful, amazing, amazing. Chris, do you want to share what your values, your strengths, and your growth areas are, as well as the population you want to work with going forward?
Okay, thank you for the privilege. Um, uh, Starting from the professional identity and my values, currently my professional identity is a PSW worker and will soon be a mental health professional. So this sums together to be the question that goes up to say, who am I as a professional? So my core values, as I have learned so far, is about dignity and justice. Dignity in the sense that these are now non-negotiable for me. Every person deserves respect and their right to make their own choices. So you have to respect their dignity as a caregiver. And understanding the mental health, you have to be a person-centered approach and a resident-centered approach. So about the justice is still about the autonomy of a resident or a client. So the second is cultural humility. This has to go that I must keep learning from clients, respect how their culture shapes their mental health and their coping strategies. So then the area of my main strength, I think this will be more of contextual empathy. I now understand that people's struggles come from different situations like immigrant stress, hard working conditions, and the limited support. So, in a situation whereby it's a diverse country, people come from different countries and they are limited to go with, then it's hard to cope. But then, as a caregiver, we have to maintain that empathy on our residents because it's our profession and we are compassionate about that. Then the next one is compassion. That is the area of the center of the care because the approach we give to residents determines the care they receive and the trust and the confidentiality. So, and now it boils down to the state that says we no longer ask what happened to you. Currently, is what strength do you have instead of what is wrong with you. These are modifying situations to make residents and individuals feel worth of living because a lot is going through many. Then my biggest area of growth as it stands right now is about becoming advocate because I understand injustice critically, but speaking out, challenging it is a bit difficult. So I need to grow into a role of advocacy, not just being a caregiver. Then another area is understanding my professional risky. Yeah, sometimes I would say it's more of emotional cost of caring. That is to say that I have to go under a moral distress. This is a pain of knowing the right thing to do, but being able to do it, I might be blocked by the rules or system. It touches my moral distress. It makes me to go moral distressing. Then example of such is from the project that we just had now, knowing that farm workers, because we just concluded a project in this our mental health course. So it's just like trying to get people that come from different countries to come and work here. So you now notice that some of them they have fear, distance, language, isolation, and many more. But in my own area of work as a PSW currently, I know a client needs more time to schedule. Don't allow it. In mental health also, how poverty and housing make recovery harder and cannot fix this big problem. So these have been my moral distress. Then others could still be like compassion fatigue and maybe vicarious trauma because I feel deeply for others. I can absorb their pain without care. This can lead to emotional tiredness and feeling like I am not helping enough. So I feel that in the area of resilience and the sustainable plan, yeah, I will stay strong in this my work. I know. I created a plan to protect myself and my well-being while keeping fit and working efficiently. So irrespective of the regular stress, peer support, then I still have to act on that as of advocacy. What I will do once a month, take one small action to improve client care. Example, for a translated materials or small policy changes. Then why? Anti-oppressive. Hello?
Keep going, keep going, keep going.
Okay, so in conclusion, this is more or less like a main message for caring, and that is what I feel that my main message title here becomes caring requires justice. Then my biggest lesson is that this has shown me that caring for people and fighting for justice go together. We cannot fully support clients if we ignore the systems that harm them. Thank you.
Well, thank you so much. It's really a well thought um, reflection for you, right? You talked about human dignity, you talked about how vulnerable you are, and you also concluded on areas of learnings for you. So for me, like I rightly said, I think we have some things in common, which has to be that we have our healthcare backgrounds one way or the other. And for me, while I was in the profession, my whole thought process was more on mental health, substance use, and addiction from just the biomedical lens. So I just approach it through that means, through a purely medical lens. I believe that clinical interventions will address the complexities of mental illness. However, through active participation in the intersectoral and cross-ministerial collaboration course, my perspective fundamentally transformed, not just there, but also in the conditions that elevate risk and in the evidence-based intervention classes we had last semester. I now understand that mental health exists at the intersection of biology, psychology, social context, and structural determinants. My core values have evolved from just looking at it from that lens to more seeing mental health as a holistic, person-centered care, employing trauma-informed practice like we had the class this morning, and using collaborative partnership with clients to really profess solutions to the problem. Also recognizing that um, there are social determinants of health. So what strengths do I bring? First and foremost, being a nurse is one of my is one of my strengths, and having to understand some of the symptoms, the diagnosis, and evidence-based interventions. Secondly, is I'm always open to learning, so I'm committed to growth. I actively engage in reflective practices as we're doing now, and I seek opportunities to expand beyond my initial perspective. Okay. Collaborative mindsets, through role plays that we had in the class, through scenario-based learning, I have been able to develop skills in the escalation, therapeutic communication, and boundary maintenance. Cultural humility. We all come from, I think most of us come from the western part of Africa. We all have our own culture, our perspective. We all have our own values. But coming here, we see a lot of things different. So I have recognized that each client's lived experience shapes their journey, and I approach care with curiosity rather than assumption, like assuming that this is why the person is doing this. But just to know, like Chris rightly mentioned, not what is wrong with you, rather, but to talk about what has happened to you. Tell me more. What is it? Like, how has it been for you? Sincerely and genuinely asking to understand what has led them to where they are right now. So, however, there are still some areas of growth that I have been able to identify. One of them is I'm still learning to sit with uncertainty, like understanding that there is a complexity in mental health. I still wonder how we can manage the complexity. It's really ambiguous to fix complex psychosocial challenges with just purely clinical solutions. So I just have to change my mindset in that area. Secondly, is systems thinking, right? By virtue of being a student in this course, I've been able to understand how other areas in the system, such as house instability, poverty, discrimination, and policy gaps impact mental health, which requires an ongoing learning as well. So in terms of crisis, I try to detach myself from the crisis. It's not just about allowing the crisis to, I'm still learning how to see how I can detach myself, because understanding that this is professional and this is personal. So managing my own reactions during code white responses are high stress situations for me, and while I'm still maintaining that therapeutic presence. So these are areas of growth for me, and also like you all mentioned, also about advocacy beyond individual care. So moving from individual intervention to addressing barriers that requires skill development. Back to the population and environment that resonates well with me, I feel most aligned with individuals experiencing co-occurring mental health and substance use challenges, particularly in community-based settings where wraparound support is available. The intersectional collaboration model resonates deeply. I thrive when working alongside with house workers, peer support specialists, primary caregivers, and social service agencies. I find meaning in environments that challenge the biomedical model and embrace harm reduction and anti-oppressive practices and client autonomy. So some of the challenges I'm still navigating, I sometimes struggle when clients refuse treatment. Like, you have the best interest for them, you really want to help them, but I mean, the choice is for them to make. I perceive as harmful, but my initial training emphasized compliance and medical authority. So, I mean, so learning to respect client self-determination, even when I disagree, challenges me really. And I think it also does with all of us. And for the viewers as well, it's also a complex situation we have found ourselves in. So, in conclusion, in this first episode, additionally, working with individuals experiencing severe addiction or chronic relapse or can trigger feelings of helplessness when I can't rescue them. Um, I would say this is really a deep reflection for me. I don't know for you, Nyla, and for Chris. How has it been for you so far? I mean, how did you feel? What was your reactions while you were having this deep reflection on how far you have gone so far? For you, Chris, how has it been?
Naila, come first. I'm coming.
Okay,
Oh,
Nyla.
so for me, so far so good.
Yeah,
At first, I was really scared,
yeah.
but I said to myself, yes, you can do it. You can do this course. Yes. So my professional identity has really been shaped by navigating two healthcare systems, adapting to a new cultural environment, and supporting individual with complex physical, cognitive, and emotional needs. This reflection has really um how do I say it? This reflection explore who I am becoming as a future mental health professional, how my personal traits and lived experience connect to the emotional and ethical risks for this field, and the resilience strategies I will use to maintain well-being and sustainability throughout my
Yeah, we're
career.
going to talk more about the resilience in the coming episodes. We're going to talk about our vulnerabilities in the coming episodes. But here we are just emphasizing on how the journey has been for us so far. And Chris, would you want to, in conclusion, give your final words to this episode?
Okay. My conclusion here is that at the close of each day work, I reflect on the document and the strength I demonstrated by a resident, and the one strength I utilize myself is the practice of intentional shift focus from deficit to capacities. You know, theoretically grounding. This is inspired by the harm reduction principles of meeting clients where they are at, and our capstone project also strengthen my inventory, my conscious of honoring the resilience and the resources present in both my resident and myself. So to protect my mindset from my caring and the nurture to sense of hope, which is the bedrock of the sustainable practice. Thank you.
Sounds good. Sounds good. We've been able to learn that these by virtue, yes, in as much as we're trying to care for people, in as much as we're trying to meet them at where they are, which helps with us experiencing, which helps with when healthcare workers or frontline workers experience burnout, which one of the reason is because we are really very compassionate about supporting them, and it leads to compassionate fatigue and then transcends into burnout traumas or burnout stress. Then we have vicarious trauma. But I mean, we've been able to have deep reflections, and we've used what we've learned in our various courses to really, shaping the way we want to be in this profession. Thank you all for your contributions. Thank you for your deep reflections and the opportunity. I think we are all privileged to hear from you all, and thank you for sharing. For our audience out there, the whole essence of this is to see how our own experiences resonates with you. And what is it for you? What's your professional resilience at this point in time? What's your strength? What are the areas of growth you have been able to explore? What populations do you work with, or what environment resonates well with you? Where you're working currently, is it what you like? Are you passionate about what you're doing? and what challenges are you navigating at this point in time? So you would all agree with me that mental health is really very complex and it comes with its challenges. So in the next episode, we'll be talking about understanding my risk, understanding what my risk is, and understanding and recognizing vulnerabilities. And how do we navigate through that? So we're expecting you in the next episode. Don't go anywhere. See you soon and goodbye. Bye.
Bye-bye.
Bye.
Yeah, I want to say kudos to all our lecturers who have taken time and their commitment to ensure that we're better mental health professionals. We lack words to say thank you. So thank you for all you do. Yeah. Bye.
Bye-bye.
Yeah.
Bye bye.